was, kind of just thinking when was I last in Kolkata. I've been here several times for personal visits. In fact, it's one of the cities where I especially came and stayed here for a week and explored the city, just walked around the city. So that's my love for the city. I've never done that in any other city in the country. I also found that, for work related to Vision Spring, I've never been to Kolkata. So that was, surprising in my almost 10 years now with the organization, that, there was no reason to come here. Now, I'm sure that the Clear Vision Tea Gardens initiative gives me enough reason to come back to Kolkata again and again. It's such a delight being here. Thank you, everyone, for also joining us on a Saturday afternoon, taking time out of your busy schedules. This initiative is extremely important to us. As we go along this journey, there is a lot to learn from all of you, because all of you are experts in the region, in eye care, in northeast and east parts of the country, and also the tea and agriculture sector. We know a lot about eye care, but we do not know much about this particular sector. So it's extremely important for us to approach this in a collaborative manner. I have a few slides. I'll keep it short, but I think it will just act as placeholders as I speak and explain what we are trying to do here. So, just to put the problem into context, there are 1.1 billion people around the world who just need a simple pair of eyeglasses to see clearly. It's not something new. It's a 700-year-old technology. So we're not doing anything innovative here. But there are so many reasons why still so many people do not have access to this simple solution. Lack of awareness, access, social stigma associated with wearing glasses, affordability, lots of factors where still so many people around the world do not have access. New York Times says it's a simple way to improve 1 billion lives, and it is indeed extremely simple, but it's foundational for social and economic development in India and around the world. All of you, being in the social sector, would have heard about United Nations Sustainable Development Goals. These are really pledges taken by organizations in the social sector around the world, that we need to, by a certain date, which is 2030 in this case, solve certain pressing problems around the world. Out of the SDGs that are there, Clear Vision is directly related to 5 of them, which is almost 25 to 30% of the total SDGs. So that's how the importance of this simple solution is. It starts with eye care, it starts as an eye intervention, but it is extremely important for learning, road safety, income earning, livelihood, skilling. So many different things are catalyzed by this simple initiative. And hence, the program areas that we work on are derived from these. C2 where we work with tea garden workers, weavers, artisans, community workers, working age adults, factory workers. C2B Safe, where our focus is to work with commercial vehicle drivers and transport workers. And the C2 Learn program, where we work with school children, helping them see clearly. If I have to put this in context, in 2018, 2019, just before COVID, we screened 100,000 weavers of Banarsi silk sarees in Varanasi. We found that 70% of them needed glasses. 80% plus were first-time wearers of glasses. That means if we hadn't gone and done the screenings, those 80% of those 70% people that needed glasses would not have got them. And it has such an important impact on their earning potential because all of them are daily wage earners. The meters of sari that they weave every single day, they get paid accordingly. Also, beyond earning potential, it's a quality of life and physical health issue because if you have seen a handloom silk sari being made, it's made in really dark conditions, and the workers are really leaning over as they are doing their work. So what it does is kind of brings about back problems, health issues, and they go out of work much earlier than they should. So it's earning potential, but much beyond in terms of quality of life. In last 5 years, we've screened more than 600,000, 6 lakh drivers across India. We found that 65% of them needed glasses to see clearly. Our commercial licensing system is such that every 3 years you need to go for a renewal. But how it happens in the country, there is no physical visit. Imagine the impact on road safety. You could build great roads, you could do a lot of work on driver training, but still our road safety is compromised. And it's not just the road safety of the person driving the vehicle, but it's all of us on the road. That's how severe the situation is. With children, the percentage is less, but we've seen post-COVID that myopia is becoming, is growing like anything. It's becoming endemic in the children, especially in urban areas, but also in rural areas as devices and digital access reaches there, and also poor nutrition. So that's also a pressing problem. The percentage varies between 8 to 16%, but catching them early and giving them a pair of glasses means we are enabling a brighter future for them. Two important things happened in 2021. There was this United Nations General Assembly resolution which unanimously voted to adopt Eye Health for All. And also the World Health Assembly Board, which focused on increasing coverage of cataracts and also increasing effective coverage of refractive error by 40%. So at the highest level, both at the United Nations and WHO, there was a lot of focus and momentum on eye care, but also refractive error, which is the need for corrective glasses. Dr. Arvind Panagria, the first vice chairman of NITI Aayog, he wrote this powerful article in the Economic Times. He said that India needs a national mission on clear vision for all. He says that it's a great bang for the buck because nothing so simple can have such profound economic impact. So with all this going on, we thought everything that we do in the country, we would do it under the umbrella of the India Clear Vision Mission or the Bharat Ujjwal Drishti Abhiyan. Because what we're trying to do is provide clear vision through glasses to everyone who needs in our country. And why is this a priority? If you see any of the Government of India missions, Skill India, Atmanirbhar Bharat, Make in India, Digital India, the Ministry of Road Transport and Highways initiatives, Beti Bachao, Beti Padhao, none of them are possible without people seeing clearly. So none of the government schemes would have the desired impact. Imagine Digital India, where half the people can't even see their mobile phones. So so it falls very nicely with the government agenda, and that's a great thing about what we are trying to do. So, as per our estimates, and these vary, but 60 crore people, around 60 crore people in the country need a pair of eyeglasses to see clearly, which is almost 40% of our population. And if you're able to put glasses on everyone's faces, we would increase minimum, it's a pessimistic figure that we have taken based on a 2008 study, and not considering any inflation or anything. 5% is the increase of GDP of our country if you are able to help people see clearly. So that's humongous impact. At a political level, this can be a game changer. And and that's the reason why we can get a lot of help and support from the government here. So, we need to, as I began initially, work in partnerships together, with people who can fund these initiatives, government and regulators, IK providers, and influencers and facilitators who can bring this cause to the center of the national agenda. Little bit as I talk more about the livelihoods in focus program, I just wanted to give a context of very briefly the work that we do. We've screened more than we've helped more than 5.5 million people now, actually more than 6 million people across India with a pair of eyeglasses. And we're providing 1 million people with glasses annually. We have all the infrastructure. We have the first solar-powered lens lab in the country and perhaps anywhere in the world driving our glasses. We have the most efficient SAP-enabled supply chain system to power our work. And last year we took this big step to start manufacturing glasses in India. So 100% of our glasses are now manufactured within India to support the Atmanirbhar Bharat mission of our government. And we, with that, we would have efficiencies, reduce the cost of the intervention, and also improve quality because we are in a position now to generate insights from users of glasses locally and convert them into the designs and shapes that we require. So through our work, we've created more than $1 billion of economic impact, $1.3 billion to be exact. Again, these are very conservative figures. So a lot of organizations these days like to use the word unicorn. Any unicorn, a startup becomes a unicorn when they have a $1 billion valuation. We feel that we are also a unicorn because we do not have $1 billion valuation, but we do have $1 billion economic impact created through our work in the country. And hence, we feel that that's the power of our organization and the work that we do. Talking about the livelihoods in focus program, Mr. Sidhu preempted me by talking about how many screenings that we have done in Assam in the tea gardens. But this is just a start. While we started with this initiative in 2014, 2018, when we did the study that Mr. Sidhu talked about, we really thought that this really needs full focus. And as a result, we started working on the tea gardens. So we already screened 80,000, but the goal is to screen 10 lakh people in the tea gardens, starting with Assam and West Bengal, but going to other tea and coffee growing regions around the country. So this project, a global project, would require $70 million of investment if we have to touch 12 million people globally and provide a conservative estimate is that 50% of those people would require glasses. And this goes across 6 countries. And these are some of the target countries, largely India, Bangladesh, the Indian subcontinent, and Africa. Our goal is that if we have to do this, let's start with India, where we have some experience of tea and coffee, and then go to Africa and other parts in a big way. These studies are not spend much time because Mr. Sidhu has already talked about how it can lead to up to a 32% increase in productivity. And a further study in Bangladesh with workers says that 38% more likely, more the likelihood of people moving into a higher quartile of income if they are wearing their glasses. So through this initiative, our goal is to work with agricultural workers, tea, coffee, cocoa, artisans, micro-entrepreneurs. This has been termed as the largest increase in productivity due to any health intervention, not just eye care, but any health intervention. If we can put glasses on people's faces, we get the largest increase in productivity. So, as I said before, it's productivity, yes, but it's also about the quality of life, self-confidence, and dignity of people. So, why we are focusing on this particular target segment? One, these are all very visually intensive occupations. Weavers, teeth pickers, teeth sorters, the high rates of uncorrected refractive error. This year we've experienced that 90% of the people that we touch in the tea gardens in Assam are first-time wearers of glasses. This is a very organized structural, sector to reach. Unlike many other sectors where we have to look for people, going into a tea garden or a coffee plantation is much easier to conduct the screening. And these are very economically important for the country. As we're trying to increase our exports, make India self-reliant, this sector gains added importance. In 2020-2021, we had Deloitte do a study for us, and they identified 8 districts in Assam, largely in Upper Assam, where weavers, artisans, and tea pickers overlap. And our focus has been since then to work in those districts, but we've slowly started to go in other parts of the country. This year we would go to West Bengal. We've already started working in Palampur in the Kangra Valley up north. We also did our first ever coffee plantation screening this year in Wayanad in Kerala. So the idea is to cover everywhere, but we know that we need to start where the problem is the most, which is Assam and West Bengal. But we need all of you to come together. We've got some funding for the initiative, we need more funding. And there's so many different ways in which people can help. People can offer in-kind support, help in mobilization, access, advocacy, introduce us to funders. And because you know the sector very well, you know the region very well. So we would look upon on your support to help us achieve this objective. There are also new things coming in. One of the new things that's happened in the funding space this year is a concept called the social stock exchange. SEBI has notified a separate wing called the social stock exchange as part of the NSE. And the idea of social stock exchange is that not-for-profits can actually list zero principal, zero coupon bonds and get funding for their social impact initiatives. To make the idea is to make the funding transparent. The issue size starts with 1 crore rupees, the application size starts with just 2 lakh rupees. So if the industry can get together and raise that kind of money, which is not much, to start off in the tea gardens and to probably launch the first ever tea garden bond in the world, it would give us a lot of awareness and attract large donors to come in and support this initiative. And that's where the industry support is vital as we take the initial steps. And this is going to be a unique concept, not done anywhere, not just for tea, but I would say for any agricultural commodity anywhere in the world. I would also like to, Mr. Jyoti Phukan is here. Also, our conversations that happened in Guwahati, we talked about the rupees 1,000 crore Pradhan Mantri Charshram Protsahan Yojana, which is basically a welfare scheme for the tea garden workers. 1,000 crores government announced in 2021 for the welfare of tea garden workers. It's not, it's been announced, but it's not really sanctioned. So, his guidance led us to meet the secretary in the Commerce Ministry. We wrote to the Commerce Minister, who put us to the secretary, And the secretary was so happy to hear about the importance of eye screening for the tea garden workers. He said, we're in the process in the next 2 to 3 months to get this going, and we will ensure that we earmark some of the funding for eye screening and glasses for tea garden workers. We had no idea about this scheme. It's just because of an expert like Mr. Phukan who could tell us about what are some of those government schemes that already exist for tea garden workers. So that's where, that kind of support that's required for us to understand this sector very well. Otherwise, it will take us years to, understand first and then execute. And because we partner a lot with, diverse organizations, our implementation on the ground is also much faster. Our understanding of the local context, culture, and communities is also much faster. So with that, I would give rest to my voice and request support from all of you as we work on this ambitious mission. And since we launched this in Assam in Jan, there are also already a lot of people who have actually become partners and working to with us to make this into reality. And with all wonderful people in the room today, gives us a lot of confidence that we'll indeed make this happen. So thank you everyone for your time, and thanks for giving me this opportunity to talk about this initiative.
Thank you, Anshu. I would now like to invite Mr. Dipankar Bhattacharya from CII to